on at the event. When we think about sexual health, often people think that it's only about prevention of illnesses, of diseases, but it's not just about that. It's not just about contraception. It's about your well-being as well, yeah? Being part of that decision, yeah? Not just thinking about prevention of diseases or contraception, but also being mindful for it to be a pleasurable experience for you. In our culture, sex is quite a taboo subject, and some of the images I will display are quite troubling. But as I apologized earlier, I don't mean any offense. Sexual health requires us to be, it needs a holistic approach whereby we have to be mindful about our psychological well-being, our emotional well-being, our spiritual well-being. It's also important to have an understanding about what sexuality is. When patients come into the clinic, one of the questions we ask is, what's your sexuality? And they'll say straight, or they might not be straight, but it's not just about whether you're straight or gay or a lesbian. It's about your selfhood, having a relationship with yourself. If there's anything that I can ask listeners to take away today, is to have a commitment to have a relationship to yourself. I understand, yeah. As I said earlier, a brother has told me birth control is death control, yeah. As I have told the audience that I'm speaking from a health advisor's point of view. I am a conscious sister, but I'm also talking about people coming into the clinic, what they experience, and the holisticness of what sexual health is. Yeah? It's also mindful when we think about sexual health, yeah? To enjoy it, yeah? To communicate to your partner, and to have some practical exercises in your relationship. Sometimes we find ourselves with problems like we've gone off sex, or sex is painful, or one can't maintain an erection, and we shy away from that. But it's quite worthwhile to be open and to have an opportunity to speak to your partner about it, or come to people who could help you with that issue. But I would like to remind you that it's not just about that. That infections are divided into bacterial infections, there are viral infections, and there are fungal infections. And there are also parasitic infections. And there is one particular infection a condition that women are troubled by, that is an imbalance in the bacteria. That's called bacterial vaginosis, and that can cause a fishy, smelly discharge. And a lot of women can be uncomfortable thinking they have an infection. A particular infection a condition that women are troubled by, that is an imbalance in the bacteria. That's called bacterial vaginosis, and that can cause a fishy, smelly discharge. And a lot of women can be uncomfortable thinking they have an infection. But it's just when we wash or overwash, we upset the pH level in our vagina, and that can cause an imbalance, and as a result can lead to that fishy smell discharge. Here it's important to also understand factors that affect one's sexual health. Yeah? Rather, one not to have a voice in negotiating how they want to be in a relationship, or have the power to use maybe protection. One of the factors that affect people's ability to make informed choices is a sense of positive self-esteem. A low self-esteem or sense of worth, yeah, one will end up seeking approval from the outside. I've had a few women visit the clinic, yeah? Not necessarily that they want to have sex, but they feel because throughout the years, things like bullying at school can affect one's self-esteem. The things we hear when we are growing up and we are not honored or seen sometimes by our family or people around us can kind of have an impact on our self-esteem. So when we grow up into adulthood, we're unable to find a voice, or the way we need to find validation is through relating to men. The accurate information is also important in empowering yourself with how one could get sexually transmitted infections or the symptoms one might get, or knowing that the clinics, there are sexual health clinics across the country and you can attend any to get yourself checked out. Or even your inner guidance is always speaking to you. If you feel maybe the partner you've been with, things just are not right, it's worthwhile to follow your guidance and attend a sexual health. So it's important also an understanding of the rights and responsibility to oneself and others. For example, some women sense of sexual rights or self-esteem has not grown with the cultural pressures on them to be sexually available, active. Yeah? Sometimes in couples, one could be tired, but because of our nature, sometimes to cooperate with your partner, you go ahead and put yourself in that place, yet the body is already quite exhausted. Yeah? And when our bodies are exhausted, they won't naturally lubricate themselves. Like for women, if you're having sex and it's dry, that can bring up an outbreak of thrush. Yeah? And then that will cause you more discomfort and more worry. So it's worthwhile, something I touched on earlier, is to be true to oneself. And if your body feels tired, maybe it's not ideal to get yourself to that place. Our values as well, the things we've had when we are younger, and our views about sex do not enable us to have an intimate relationship with ourselves or understand how we would want to be loved or how we would want to be honored in that place. So then we give partners mixed messages, we feel dishonored, and then we continuously compromise ourselves, and that can end up leaving us in a risky place. These are the risk factors that have been found really for people who have attended sexual health clinics. I'm afraid to say, as African people, we are amongst those groups that it is a risk factor for us attending or ending up with infections. Yeah? And that goes again, in most cases, we live in very deprived areas, or we are not supported, or things like racism can leave one self-esteem wounded. Yeah? And in turn, we might not be able to negotiate safe sex. If we don't have a relationship with ourselves, then it will be more difficult even to negotiate what we want in a relationship. Yeah? Multiple partners, young people, there is a lot of pressure to have sex nowadays. What's in the media, there's always pressure. A lot of young people do not necessarily want to have sex, but because their peers are and what the media is also saying, then they find themselves in that place. And once again, a low awareness of what sexually transmitted infections are is another risk factor. So the bacterial infections are chlamydia, gonorrhea, and syphilis. The parasitic infections are trichomonas. I won't be able to go through trichomonas. Trichomonas is a small parasite that causes an irritation in a woman's vagina, and it's mostly picked up in women when women attend clinics, but sometimes it can be asymptomatic. There could be no symptoms. It's not necessarily diagnosed in men, so when we find a partner, a female partner who's got trichomonas, which might be referred to as TB, their male partner will also be treated. It has no complications, but because it's irritating the vagina, that increases your risk of picking up things like HIV, so it's worthwhile to be treated. Scabies, that's an irritation in the skin, a small parasite as well, and that can be transmitted through sharing clothing or bed linen. So there's a cream to treat that, and usually patients are advised to do a hot wash and put any clothes that are in the wardrobe, tie them back up in a plastic bag. That could end up getting rid of scabies, and pubic lice is also similar. The viral infections, I need to say that bacterial infections are treatable. When people attend any sexual health clinics or some young people's clinics, chlamydia, gonorrhea, and syphilis are treatable by antibiotics, but viral infections are not treatable. When a virus gets into our body, we can't get rid of it. But the way the Creator made our body, it was made in a unique way that most of the viruses our body can manage the infections. But some, if they find a diseased environment, a diseased body, and emotional imbalance within oneself, then it can cause severe complications. The viruses are herpes, genital warts, hepatitis B, hepatitis C, HIV, and molluscum. And the fungal infections are thrush, which I touched on, and balanitis is an skin irritation in men, and it can be caused by even something like bacterial vaginosis, the infection I talked about when we get, if we have an imbalance. Chlamydia is one of really the most commonest sexually transmitted infection, and the media refers to it as a silent infection because in most cases, people don't have symptoms. Up to 80% of women will not have symptoms if they have chlamydia, and about 50% of men will not have any symptoms if they have chlamydia. Chlamydia is sexually transmitted. As I said, it's bacterial, and it can be treated. Chlamydia cannot be got through sharing towels like scabies or pubic lice. You cannot get it on the toilet. You get it through sex. The type of sex is either oral sex. Sometimes even people, before, if they choose to use condoms, before a condom is put on, there's genital contact, then one can get chlamydia. If one touches fluid, genital fluid, like vaginal fluid or semen, and they have chlamydia infection and accidentally touch their eye, they can transmit the infection to their eye. Or even if a man has that liquid fluid and touches a woman, they can also pass on chlamydia to them. As I mentioned earlier, that most people don't show symptoms if they have chlamydia, and those that do, especially in the throat, there are hardly any symptoms if you have chlamydia in the throat. In the rectal, you could get symptoms. For those who get symptoms, the symptoms could be like a white, cloudy, clear discharge, watery discharge. For men, pain when they're passing urine, and testicular pain. For women, it's an unusual discharge, pain when they're passing urine, they could bleed between their periods, they could have pain during sex, and lower abdominal pains, or they could have nausea. Nowadays, the test that's done for chlamydia is not as invasive for men as it used to be. For men, it's just passing urine, and for women, there's a self-swab that they take that will look for chlamydia and gonorrhea. The incubation period for chlamydia is 2 weeks. If you have sex and test after a week, we won't be able to pick up the. In some clinics, because the dosage is stronger, they'll give you 2 tablets or a week's course of doxycycline. For women who are pregnant, they have a different treatment. This is chlamydia in the eye. Remember, I spoke earlier. Complications of untreated chlamydia. If chlamydia is not treated, it can cause severe complications. For women, it can travel to the reproductive organs. It can travel to the, I have 5 minutes left. I needed an hour, but okay, I'll try and hurry up. The complications for chlamydia are that the infection will travel to the reproductive organ and cause it to be inflamed. If the womb is cut, the baby can't develop in the womb, so it ends up developing in the little tubes, fallopian tubes. That's called ectopic pregnancy, and that can be fatal because as the baby develops, those tubes can't hold the baby, so it erupts. For men, it can cause something, severe pains in their testicles, infertility, because it will scar them. Yeah. Gonorrhea has similar symptoms like chlamydia, and also the complications are similar as well, infertility. The other bacterial infection is syphilis. It's not so common amongst heterosexual patients that we see, but it's mostly common like in people who sell sex. This is an example of syphilis. Syphilis happens in 3 stages. The primary stage, this is what it can be. It's a painless sore. It can heal and go on its own. Then it develops into a bodily rash. Then syphilis is infectious for the first two years. After that, it can remain within us and cause further complications 15 to 30 years down the road. So this is an image of one who had congenital syphilis. The mother passed on syphilis to the baby when they were born. This is what can happen, but it's treatable by antibiotics. HIV, as you know, is a virus. I'm aware I have to stop soon, but I want to touch on one viral infection that leaves people very, very anxious, but they shouldn't be that anxious. Yeah. Herpes, yeah, genital herpes. Yeah. A lot of diagnoses that we see in the 2 clinics that I work in are mostly women presenting with herpes, and in most cases they're very, very distraught, yeah? Because when you tell them that they have to live with the virus for life, they are very troubled by that. Sometimes it's as if you've told them that they have an HIV diagnosis. So it's worthwhile for the listeners, for the audience to know that herpes is something you can live well with. There are 2 types of herpes, type 1, type 2. Type 1 mostly affects the oral area. Type 2 is more genital specific, but one could also get type 1 in the genital area. It depends what was passed on. A lot of people get herpes when they don't have when their partners don't have symptoms. It's a skin-to-skin contact transmission. So even when one wears a condom, that herpes sore may appear in an area where the condom doesn't cover, so skin-to-skin contact will pass on the virus to their partner. It's a virus that one can live well with. When patients come into the clinic, I often tell them, because there is a link with herpes with the way you're looking after yourself. If you're stressed, run down, not eating well, not resting, you're bound to have an outbreak. If you have herpes type 2, you're likely to have more outbreaks than if you had type 1. But if you have type 1 and you don't look after yourself, you can still have those outbreaks. So it's worthwhile to know if one has an outbreak, it's mostly to do with you not looking after yourself. So it's worthwhile for you to check in. It's a reminder for you to check in with yourself, how you have been. Have you been stressing? Have you been managing to eat? Have you been managing to rest? Because the more you stress about it, the more you don't work in harmony with it, then it can cause you a lot of emotional discomfort. It tends not to cause many complications, but more a psychological concern, because especially for those people who keep on having recurrent outbreaks, it can be quite troubling. It can also be very painful. The sores are painful. I know you've seen the syphilis ones. The syphilis sores don't tend to be painful, but the herpes ones tend to be painful. For those who have recently been exposed to it, they can get symptoms like a fever or tingling sensation in the area. It starts as a blister. When that bursts, then the sore, and that can be very painful. I will be having a workshop. I feel I'm rushed, but through the workshop, if anybody wants to talk about sexual health, that they are open to use that space. But I would like to leave you with a few points. Yeah, I think for me the most important thing about sexual health wellness is having a relationship with yourself. Yeah? When you have a relationship with yourself, then you can be clear with your immediate partner and the people around you. But it's a commitment to self and trying to find out how can somebody please you. Yeah? How can you find time for that space than rushing or having sex when you're tired? A lot of the infections are treatable or manageable. Even HIV is manageable if you make a choice to live well with it. Thank you for listening. Thank you for your patience. And for those that have offended, I have tried to be as gentle as I can to speak about the facts. Thank
you. Do lambskin condom protect you against STIs? Yeah, that's fine.
I'm not familiar with lambskin condoms. There are two types of condoms we give in both the clinics I work in. There are latex condoms or non-latex condoms. Those are the ones that I'm familiar with. I'm aware there is a lot of research whereby people say condoms don't work. As a sexual health advisor, if one uses condoms well, they could protect them. But before you go to that place, you have to have a relationship with the condoms. If your relationship with condoms is anti them, they are bound not to work with you, because the energy you're giving them even before you get to that place is not in harmony. So whatever I have said, as I said earlier, some things will speak to you, some won't. Yeah? I'm speaking to highly conscious people. I've talked about antibiotics. A brother asked a question, how Western medicine is genocide. I'm aware about that. But I was talking about if you came into a sexual health clinic, that could be what your experience would be. Yeah. Thank you.
Thank you.
Greetings, family. My name is Val Gordon, and I am originally from the Caribbean island of Grenada. What makes us do the thing